the Sunday show on NTA Channel 10.
Next on our lineup is the Meet the Doctor segment, and today's topic is miscarriage part 2.
All right, I tell you that topic is quite exciting.
Yeah.
And a lot of families at times, they have that type of problem, you know, and the doctors really do research to tell us, because that's why the program is quite important. We talk about health, we talk about all kinds of things. So if you want to know more about miscarriage, let's listen to this doctor. This is the part 2 segment. Let's take it.
How do we prevent this, recurrent miscarriages? It's very difficult. It's a difficult subject. That's why we're talking about it anyway. You go to your doctor, you give your history. I've lost pregnancy 3 times. What can I do, doctor? And then the next thing is to ask the following questions. Have you ever had a miscarriage of which you went to the doctor to do an evacuation? You say yes. Then the next thing that comes in our mind is, when the evacuation was done, was it done through the modern method, or they used the old-fashioned D&C, whereby there's trauma to the cervix? When there's trauma to the cervix, then there's bound to be laxity in the cervix. People who have got congenital problems, softening of the connective tissues, that one you can't prevent, but you can at least offer 1 or 2 things to do. Babies or embryos that have genetic chromosomal problems, well, there's also little to which we can do, but we can select the embryo a bit and offer some medications to assist. The use of folic acid is crucial. We use folic acid when we are pregnant to prevent abnormalities of the spine and the likes. So I know it is a common thing to say that, oh, a pregnancy is lost and another one is lost and another one is lost. And somebody will tell you, in my village, there's somebody who does hanging of the uterus, whatever it is, to prevent miscarriages. Well, we don't know how about that, but what we know in the orthodox medicine is we can tie the mouth of the womb, can make it a bit tighter to prevent mechanical pushing of the of the content of the womb outside. The one we call cervical sacrilege. Cervical sacrilege, is some kind of important terms in our job, whereby we take a mechanical suture. We do it. We tie it around the mouth of the womb. We tighten it a bit. We let the woman go away for some time, and when the baby is due, say 36, 37 weeks of pregnancy, we remove it to allow normal labor to ensue. The other thing one can do, of course, one must be on the regular antenatal medications, the vitamins, the supplements. You attend your antenatal classes. You ensure that, well, they will ask me as well, Professor, I've done a sacrilege. Okay, people know it as Shirotka. I've done a Shirotka. And I heard that I'm not supposed to have intercourse with my partner. Is it true or false? I tell them, yes, it is true. But it's not true, it's not absolute not having intercourse. It's a modified intercourse, whereby, don't allow deep penetration. There are many methods at that, which we can talk about some other time. But to saying there's no absolute, that one mustn't do intercourse, it's a bit too far. But the reason why we advise not to do intercourse is not to introduce infection into the uterus, which can also elicit miscarriages.